All right, good evening. We're going to go ahead and get started. Welcome everyone to our regular community teleconference call tonight. My name is Marcia Noel, assistant to the city manager moderating our call. This evening, we do have a few speakers ready to share some valuable information with you on the latest updates regarding COVID-19 and city services. We have our city manager, fire chief, and our YEP director to present to you. We do want to make sure that as many people as possible are accessing this call. So if you are watching online on TV or join this call, please share this call and let others you know tune in as well. First, we're going to make sure that we start off with staff updates, and then afterwards we'll open the floor for any questions from members of the community that have joined this line. So with that being said, we're actually going to go ahead and start with a report from our operations section chief. Afterwards, we'll hear from our health and human services section chief and, if possible, the city manager. So with that being said, Chief Kurt, if you can begin.
Yes, thank you, Ms. Noel, and good evening, everyone. John Kurt, Fire Chief, serving as the Operations Section Chief. As always, I like to start off with the numbers on what we're seeing and what's trending as it relates to COVID-19, and we'll talk a little bit as well about the vaccine that seems to be dominating the airwaves. But to start off with the numbers in the U.S. now, we have surpassed 17 million cases of COVID-19. We've seen 308,000 deaths associated with COVID-19. And unfortunately, yesterday was a record day in regards to the number of deaths recorded in one day since the beginning of the pandemic at 3,611. Very staggering number that we lose 3,600 people in one day to COVID-19, and we're seeing trends of 2,000 and 3,000 individuals a day. In Florida, we have seen a total of 1,155,335 total cases, with 20,490 deaths. And in Palm Beach County, there have been a total of 73,998 total cases, with 1,796 deaths. And one of the metrics that we monitor to determine the activity of the virus in and around our community are the daily positivity rates and the census tract numbers. The daily positivity rate yesterday for the state of Florida was at 9.27, and for Palm Beach County, it was 8.28. These numbers are still concerning to us, especially as we move into the holiday season. Obviously, we want to keep that number as low as possible and avoid those numbers of 10% where it's associated with the term community spread once we're over that 10% threshold. So it is going to be a very trying holiday season with the cases still being active. There is concerns of what's referenced as compounding with Christmas and New Year's. We clearly saw a spike in the number of COVID cases in the week after Thanksgiving. The fear and the term that's being used, compounding, means that we're going to see a situation where individuals will be getting together for the holidays, Christmas Eve. That's when we're going to see a significant spike. And on the top of that spike, we're then going to see individuals gathering for New Year's Eve and New Year's Day, which is going to cause a subsequent spike, which is what they call compounding. And that second spike could be a lot more significant than the first spike or what we saw over the Thanksgiving weekend. We're going to continue to plead and implore to our community that we do the right things in our community. We've done an exceptional job. And I really wish that in some way, shape, or form, I could express to you all, other than words, and seeing what I've seen in Palm Beach County and in the state for that matter, the number of cases that have gone on in various communities and the number of deaths throughout various communities. And we've done an extremely exceptional job. And a lot of it is due to the precautions that you all are taking within our community. Physical distancing, making sure that we're wearing the facial coverings, hand sanitizing, and hands cleaning. You're going to keep hearing that over and over. And from the information that we're gathering, you're probably going to hear that for at least the next year. To talk a little bit about the vaccine, we can put an end to COVID with this vaccine. However, it is going to require 70% of the population to vaccinate in order for herd immunity to take effect. Basically, there will be so many people vaccinated that the virus will have nowhere to go, and ultimately the virus dies out. In order for that to happen, again, we must look at taking the vaccine. We must look at continuing with a lot of the requirements that we still see, because even in the regimen of taking the vaccine, the virus is still transmissible. So there's still going to be a significant amount of time between when the vaccine becomes available while taking the vaccine, because remember, many of these vaccines are a 2-dose regimen that takes almost a month in between doses, and then another 2 weeks after the second dose before the individual is completely immune to the virus. And there's still a possibility, remembering the virus is or the vaccine is only 95%, 90 to 95%, depending on the vaccine that you're taking, its effectiveness or its efficacy, as you may have heard in the news. So there still will be a potential. However, we need to look at making sure that our community is provided access to the vaccine as soon as that vaccine becomes available for the general public. As it relates to the vaccine rollout, I've been monitoring it very closely. City staff has put together what is called a closed pod plan. There was original conversations about vaccine being distributed right to the city of Riviera Beach. We put a plan together, submitted it to the Department of Health, got approval. However, they decided to not use the closed pod program, and the governor has decided that we're going to be using what's called an open pod system. And we've also partnered, I say we, meaning emergency medicine, the county and the state, with Walgreens and CVS to provide this vaccine, because we feel they can do it on a lot larger scale than anybody else. So that's exciting news. The vaccine has been delivered to the state of Florida. The Pfizer vaccine was delivered this week. Inoculations are beginning. And there were 5 hospitals in the state of Florida that received the vaccine. One was in Miami, one was in Broward, one was in the Orlando area, one in the Tampa area, and one in Jacksonville. It is anticipated that Palm Beach County will be receiving the Moderna vaccine, which should be arriving early next week. So there are going to be a couple of different types of vaccines out there. It is going to be very important, and it's going to be incumbent upon you all as the community to understand, when you take a vaccine, if you take the Pfizer vaccine, the first dose, the second dose must also be Pfizer. Same thing with Moderna. If your first dose is a Moderna vaccine, your second dose must be from Moderna. They're working on providing cards that you're going to need to be able to keep to prove that you're going through the process and to show what vaccine you were given the first day. So when individuals are being provided the vaccine, you will get your shot. They will provide you a card. They will automatically schedule you for your second appointment, but you will need to maintain possession of that card so that you can present it during your second dose or second regimen to ensure that you're taking the vaccines at the right intervals of time, and also that you're taking it from the same manufacturer. Right now, the state is working on phase 1A. This is the distribution plan set forth by the governor, and he's included nursing homes, assisted living facilities, and frontline healthcare workers, those healthcare workers at the hospitals working with and around COVID patients. In phase 1A, they did not include independent living facilities or senior centers. They did not include individuals over the age of 65. They did not include first responders. We expect these groups to be included in subsequent phases. However, we are going to reach a point here very quickly where we've utilized more of the vaccine than is available. It's not anticipated that the vaccine will be available to the general public for anywhere between the next 3 to 6 months. However, they are going to be working on, in the early stages, making sure that those at risk, those over 65, seniors living in independent facilities and senior centers are being taken care of as long as first responders. But the general public who is under the age of 65, who is generally in good health, will have to wait for subsequent rounds before the vaccine is going to be available to them. So again, we're going to have to really work hard this holiday season. I understand this is a time where we all want to be with family. It is recommended by the CDC that if you're going to be with family, you actually surround yourself with your immediate family members, those in your household unit. Try not to attend or host large gatherings. If you can avoid travel, it's recommended and strongly suggested that you avoid travel. And we're going to have to make sure we go through this holiday season with a little more caution than we've had in the past. And if we can work through it this year, I am very optimistic and very hopeful that next year's holiday season will be completely different than what we're seeing this year. So I urge each and every one of you to take the necessary precautions. I pray that you have a healthy and joyful holiday season. And I want you to just understand that we're going to continue to stay on top of this, making sure that you all have the latest information. But I just want to sign off with wishing each and every one of you a happy holiday season. And with that, I turn it back over to you, Ms. Noel.
Thank you, Chief Kurd. Lastly, we're going to hear from our Health and Human Services Section Chief, Ms. Grimsley.
Yes, thank you. This is Valerie Grimsley, YEP Director and your Health and Human Services Section Chief. I'd like to start off with talking about our food distributions held within the city. Health and Human Services provide food distributions on Fridays at Wells Recreation Center from 9 to 11. These food distributions are brought to the city through a partnership with Feeding South Florida. The meals consist of meat, vegetables, milk, and eggs, but it can vary from week to week. These distributions will continue through the end of January. In addition, we are partnering with the Palm Beach County School District to provide 5-day meals to our students, which consist of breakfast and lunch, and these will continue as well through January 2021. These meals can be picked up on Fridays at our food distributions held at Wells. On to our COVID-19 distribution testing. The city has partnered with the United Lab to provide COVID-19 testing on Monday and Wednesdays from 9 to 4, and on Fridays from 1 to 4 o'clock. Testing is provided at no cost to the public at Wells Recreation. The PCR test done is in the back of the throat, and at this time, testing will continue through the end of December 2020, and this will, if we move forward, going forward into the 2021 year, it will depend on funding. So at this time, we're hopeful for funding, but at this time, we know that December 2020, December 31st will be our last day. In addition, persons seeking testing on Tuesdays and Thursdays can go to Jay's Ministries located at 2831 Avenue S in Riviera Beach. United Lab is also providing tests at that location from 10 to 4. Test results are provided within 24 to 48 hours by way of email, phone calls, and or text. In the event you are positive test, the lab will call you directly. There will be no email. They will call you directly, and you can speak with the lab at that time about your health. Mental health services, we know it's an issue right now. So I wanted to provide some insight and some places that you would be able to go and call to actually give assistance for you, your family, or a neighbor. During these times, we're aware of the mental strain on our residents and what they're incurring due to COVID-19 and other stressful factors that's going on in our environment. In the event there becomes a need for counseling or group meetings or just someone to pick up the phone and have a conversation with, there are resources out there to assist our families and our citizens. One thing that we can do is you can contact Center for Child Counseling at 244-9499. Also, you can contact Community Partnerships, located right here in Riviera Beach at 561-841-3500. If either of those do not work for your families, please feel free to pick up your phone and just dial 211, which has an array of services, providers, and agencies to address whatever the issue that you may be having at that time. I'd also like to address at this time some of the educational barriers that we know that our students are experiencing since COVID-19. In the event your student is experiencing an issue in completing their schoolwork or any other educational issues that we may be running into with our kids doing virtual programming, our city manager has allowed the Youth Empowerment to open to provide educational support services to our students. The city's Youth Empowerment Center stands ready to assist our parents and students to ensure our students continually have the advantage to be successful in their studies. The Youth Empowerment is open Monday through Friday from 9 to 6:30 to provide tutoring, computer and internet access, educational assistance, and advocacy. The Youth Empowerment is located at 1550 West 28th Street within the Lindsay Davis Community Center. Please be assured that social distancing will be adhered to and the facility is sanitized throughout the day. And we do provide due temperature checks prior to entry. Mass distributions is another thing that we're very, very high to make sure that our citizens and our community is serviced. There are 2 mass distributions scheduled at this time. One at Wells Recreation on Friday, December 18th from 9 to 11, and this will be held during our food distribution. In addition, we have another scheduled at Lindsay Davis Community Center, located at 1550 West 28th Street. It will be held on Wednesday, December 23rd, between the hours of 10 and 12. If you cannot be present at either of these mass distributions, please give us a call at 561-840-0135, and we'll ensure that you receive your mass. With that, I turn it back over to you, Ms. Marcia.
All right, thank you, Ms. Grimsley. All right, so we just heard from our staff on updates on our services and COVID-19. So at this time, we're going to open the floor for any questions from the community. So if you've joined us on this call, you can go ahead and dial *9 so that I can unmute you to ask your question, and I'll give it a second. All right, seeing that there's no request for a question, I do see a question on Facebook, and this seems like a question for you, Chief Kurt. I know you've kind of touched on it, but maybe for clarity in case there's still some concern. But I see a question here that says, will the city give priority to our seniors in our community? And I think that was sent during your report regarding the vaccinations. So if you can kind of clarify that in terms of what the city's intentions are with that for our seniors.
Absolutely. One of the things that I need to make sure that our community understands is we don't, in Riviera Beach, dictate who gets the vaccines and when they get them. That was part of an original plan early on where the vaccine was going to be distributed to our community, and then we were going to be able to kind of have better controls over it. Governor DeSantis and the Palm Beach County Health Department the Florida Department of Health has decided to move into another direction, but priorities will be given to seniors. There's going to be, again, right now, they're going to start off with the nursing homes and assisted living facilities. Then they're going to roll into additional phases where they're going to be addressing seniors over the age of 65. They're going to have open pod plans where you're going to be able to go to any Walgreens or CVS. And they're also going to put together a program where they're going to have strike teams available so that individuals who are over the age of 65, and even in subsequent phases, individuals that are incapable of leaving their home, they will bring the vaccine to you. So I'm going to make sure that that information is going to be available to our community. I'm going to make sure that that information gets out, whether it be through social media, whether it be through callbacks on our reverse 911 system. And obviously, we'll be having those conversations during this community call. But please understand, we have no say-so on the different phases, who's included in those phases. That is being done out of the governor's office in Tallahassee, but our community will know what groups are available to get the vaccine as soon as we know.
Thank you, Chief. All right, and seeing that that's the only other question that I've received, just know that if you have any other questions or concerns that you would like to voice to us, please know that you can send us an email. You can email us at citymanagers with an S, office@rivierebeach.org, or you can give us a call at 561-812-6597. With that being said, thank you all for tuning in. Please don't forget to share this call with everyone you know, and please have a happy holiday. Goodbye.
The organizer has disconnected. The call will now end. Goodbye.